Welcome to the Army Grand Rounds. Experience Army medicine with our host, Sergeant First Class Phillips.
Good morning. Thank you for joining us once again for the U.S. Army Grand Rounds podcast. Today with us we have Major Blair. Major Blair is an Army Certified Registered Nurse Anesthetist, or CRNA. Welcome, sir.
Thank you. Thank you for having me.
Perfect. So Major Blair joins us this morning from Fort Irwin, California.
Yes, that's correct.
Awesome. So thank you for coming up to Las Vegas today.
Yeah, I'm happy to be here, so thank you for having me.
Perfect. So today we're going to talk a little bit, just about your experience in the Army and how you entered into the Army specifically to get things started, if we may.
Yeah, sure. So I entered the military in 2013 after graduating from nursing school, Creighton University, and I was a med-surg nurse. I didn't fully know what I wanted to do with my nursing career, and I was unsure about what my Army career would look like. And I had some really good mentors. I thought I wanted to go into emergency medicine, and I actually saw CRNAs, or 66 Foxtrots, in real life doing the job in the Army. And they were doing damage control resuscitation and damage control surgery, and I knew at that point that was what I wanted to do. So I kind of took a longer road, so I went to the Army's ICU, the critical care nursing program, and then deployed. And then when I came back from deployment, I went to the USAGPAN, so United States Army Graduate Program in anesthesia nursing.
Perfect. So the nice thing about everything you just said there for our viewers is you really hit on every possible avenue to join the Army, right? So we've got some ROTC in there,
yes,
right? Prior service, so as an ROTC graduate,
yes,
right? So
yes.
Prior service, right? And then the USAGPAN program specifically.
Yes.
So a lot of great things. Why USAGPAN?
So really, it was kind of looking at the benefits of doing it versus not. When I was starting to look at CRNA schools, and it was something I knew I wanted to do, I really did enjoy the military. I love taking care of soldiers and their families, and I love the culture. However, I was unsure if I wanted to stay in to go to anesthesia school. I looked at civilian CRNA programs, and there was a couple of drawbacks for me. Some of the biggest ones was the cost. Mm-hmm. It was going to be hundreds of thousands of dollars of debt that I was not ready to take on, and then also the stability. So the military, I had health care that was covered. I never even saw a hospital bill when myself or my family was injured. And then always knowing that they were going to be well taken care of, mm-hmm. and then I was losing out on retirement. I figured the best thing for me would be able to stay in the military, continue to have my family taken care of, and then I could completely focus on school. And then additionally, the Army CRNA program has a really good reputation. It's usually ranked top 3 to 5 in the nation. And it's one of those that I knew that if I made it through the Army CRNA program, that I would be able to work in any facility under any conditions with any patient subset.
Perfect. And so with that in mind, right, a lot of folks are striving to do more, looking at the next promotion, looking at the next educational opportunity. What are some of the programs or opportunities that you've taken advantage of while you've been in service?
Yeah, absolutely. So there's a lot of educational opportunities. So I've gone and done like a combat anesthesia and resuscitation conference. I went and did a joint en route care course where it was a month of flying in the back of Blackhawks and Chinook helicopters, providing en route critical care. And I actually provide consultation for them now. I went to survival school with special operations out at Camp McCall in North Carolina. I've jumped out of airplanes, and then we do everything from working on military working dogs to providing anesthesia for pediatric patients and obstetrics. So the range of what CRNAs can do in the military is vast.
And those are things that civilian employers are looking for, I would presume.
Yes. So when I did interview with a civilian employer for off-duty employment, one of the things that they mentioned was, this looks like a resume of someone that's been doing this for 10 to 15 years. So they were pretty taken back by how much I had accomplished through the military.
And when we talk about work-life balance, because that's a huge thing today, especially in today's society, what does work-life balance look like for you as an Army CRNA?
I would say it's pretty comparable to the civilian life. Now, being a provider, you do have additional responsibilities. There's a lot of people that are looking to you because you're at the head of the bed, and with that comes a little bit more work. But I absolutely love my job. I don't have clinic. I do pull call occasionally, but every night I'm home with my family. I put my kids to bed. I'm off for 3-4 days at a time, and so really, it's a fairly good work-life balance. I would say better than most places that I've seen.
And with your experience in the Army, where all have you been stationed?
So my first duty station was at Fort Liberty, North Carolina, and then I spent some time on temporary duty during the ICU training program at Fort Sam Houston, Texas. And then I was at Fort Lewis, Washington. I deployed to the Baghdad Diplomatic Support Center in Baghdad, Iraq, the 10th Field Hospital. Spent a year in San Antonio, and then spent 2 years in El Paso, Texas, and now I'm at Fort Irwin, California.
Okay, and that has spanned about
11 years, 10 years.
And so you're averaging 2 to 3 years on assignment, roughly?
Yeah. Typically for the officer side with 66 Foxtrots, it's 2 to 3 years.
Okay. So. And then when we start talking about things, because you mentioned a deployment,
yes,
sir, what does a deployment look like for a CRNA?
Yeah, so the CRNA's prime job in the military, although it's taking care of families and doing routine surgeries and staffing a Army military treatment facility or a hospital, their primary job in the military is damage control resuscitation and damage control surgery. So our specialty is trauma anesthesia. And so we're always training for that. So when we deploy, we're typically with a Role 2 FRSD, so for resuscitative surgical detachment. And it's a 20-person team, and there's 2 CRNAs on that team. Mm-hmm. And we'll deploy for anywhere from about 4.5 to 9 months, providing trauma anesthesia for these life-saving surgeries.
And with your family back home, what does life look like while you're deployed?
So my wife actually took that opportunity to go travel the world.
Yeah.
She went and backpacked all over Asia, and she was in Japan and up in the Himalayan mountains. And so it looks different for everybody. Mm-hmm. But typically what they'll do is, now that we have a son, she'll probably move back to closer to where our parents live. Big support network there. Mm-hmm. And then I was able to still talk to her daily and shoot emails and let her know, hey, I'm doing fine. And we'd still have dates and everything like that. And then once I came back home, just settle back into normal life.
I think it's very important to point out, because deployments are part of our life. They're part of your life and your profession. But the families back home, their support is vast. Their benefits remain the same, right? So when we talk about things like insurance and things, did your wife ever have to worry while you were deployed about any of those benefits falling off?
No, all the deployments, like with the deployment, everything keeps going. Your leadership, like my leadership, still took care of my family. If there's any issues, my wife always had someone to go to. If she ran into issues, she had full access to everything on the military base. TRICARE, our medical coverage, it never went away. And then I was able to still contact her if she did have any issues and point her in the right direction. So it was never an issue.
Perfect. What is next on the horizon for your Army career?
So next on the horizon for my Army career is I should be PCSing soon. And so it looks like I'll be working at one of the civilian trauma centers for the military. I'm still awaiting orders for that. But if that's the case, then the Army will have me working in a civilian trauma center daily with assignment at one of those Role 2 FRSDs so that I can maintain those trauma anesthesia skills for deployment readiness.
Very cool. So clearly there's a great opportunity to make sure your skills are sharp at all time, right? What would you say to somebody considering Army as a career opportunity for them?
So as a 66 Foxtrot or a CRNA, the Army is a great avenue if you want stability and you want to be able to solely focus on becoming an extreme professional as a CRNA. There is no other place that is going to pay you to go to school so that you can 100% focus on your job. And when you get to the head of the bed and you're by yourself in the middle of nowhere, you want to be able to rely on that training. I went to a very remote place straight out of school, and with the Army training, I walked into the OR the first day knowing that I could take care of those patients. And so if you want that caliber of training, like, the Army's the way to go.
So leadership above all, you would say, or?
I would say the critical thinking,
Okay.
the adaptability, the flexibility. Kind of in the CRNA world, in the Army, we jokingly say that 66 Foxtrot stands for flexibility. And so, but yeah, the leadership piece is a big piece of it as well.
What have you enjoyed most about being in the Army?
How every day truly is different, and how I am always able to still be around soldiers and take care of soldiers and their families. I love being around the military. It's a different breed of people. I work with medics daily. I get to teach medics daily. They're like sponges. They soak everything up. And then, one day I might be doing surgery in the operating room. You might be doing a knee replacement, and the next day I'm running around with a backpack filled with anesthesia medications and everything I need to intubate out in the field. And then another day I'm flying in a helicopter, transferring an intubated and critically ill patient. So every day I walk through the doors in the Army facility is different. It really depends on what you see.
And those things apply to the civilian sector too, correct?
Yes, absolutely. So I actually had a scenario within the past couple of weeks where we had a major trauma patient, and they were kind of on the edge of whether they were going to make it or not. And I was able to utilize my Army training in the civilian facility, and I was using combat tourniquets. And it was something that the civilian team was like, "Oh, wow, where'd you learn that?" I was like, "Well, I'm an Army CRNA. This is like what we do 9 to 5 for our job." And so I'm constantly using my Army CRNA training, even on the civilian side.
So, sir, moonlighting is something very common within your profession, within military medicine specifically. Can you just speak a little to what that looks like for our providers?
Sure, yeah. So moonlighting, it's technically called off-duty employment. And so it's a commander's program that they can sign off on. It is a privilege, not a right. And one of the things that moonlighting does is it helps maintain readiness when there is a lack of things. So for example, at Fort Irwin, California, the National Training Center, we're there primarily as a trauma response for incidents that happen out in the field for field exercises. However, we don't see a lot of cases. And so my job is to maintain my trauma anesthesia skills along with my other anesthesia skills. And so I use off-duty employment as a way to maintain those skills. And so you fill out a packet with your commander, and then you set very specific stipulations as to I'll only work so many shifts a month, and it can't interfere with my primary job, which is being an Army CRNA. And so I actually work in Las Vegas at the trauma centers to maintain those skills. And so I come in like any other CRNA. I pick up shifts, I work cases, go through the board at the front desk, and then go back home afterward. And so, yeah.
So that brings up an interesting point when we talk about licensing, right? So our folks typically, right, I'm going to school in this state, this is a state I'm going to live in and I'm going to practice in. So how does licensing work?
So that is all on you. So for example, my nursing license and my CRNA license is in the state of Nebraska because that's where I went to undergrad, and so I've kept that for the longest time for continuity purposes. But when I wanted to moonlight, I went to the Nevada State Board of Nursing and applied for a Nevada nursing license and a CRNA license, and then I interviewed just like any other civilian CRNA.
So applying for that state license would only be required if you're moonlighting, and the Army would recognize your Nebraska license anywhere else that you went under our umbrella, correct?
Correct. So anytime that you work under a federal facility or an MTF, a military treatment facility, as long as it's within the 50 U.S. continental states, they recognize any of those, and you can practice in any military treatment facility. And so once you start stepping outside of that and you go work in the civilian side, then you need to have the appropriate licenses for that state.
Very cool. We're kind of getting to the point where we're wrapping things up. So if there's anything that you could say to somebody who's considering this as a profession, what would be your last final piece of advice for them?
Yeah, I think the biggest thing that you need to ask yourself is, no matter what you do with going through CRNA school is going to be difficult no matter where you go. It's what kind of difficulties do you want, right? If you want to have the difficulties of paying off loans and the uncertainty, then maybe the civilian route is better for you. But if you want the difficulties of being faced with challenges daily and coming in and learning a new culture and learning how to be the best independent provider that you can be, then the Army's probably the best route. It's choosing what difficulties you want along the path.
Okay, well, thank you again, sir, for joining us today. Very informative, very easygoing, easy conversation. I think a lot of great information for our viewers today.
Yeah,
so
absolutely.
thank you. Thank you. Thank you all for joining us today for the U.S. Army Grand Rounds podcast, and we look forward to seeing you again for the next episode.